Crown indemnity was a historical arrangement in the United Kingdom's National Health Service, NHS, where the government would cover the cost of clinical negligence claims against medical professionals working in NHS hospitals. This meant that doctors employed by the NHS did not need to purchase their own medical malpractice insurance, as the government would handle any claims made against them.
Evolution. However, in 1990, the NHS introduced the Clinical Negligence Scheme for Trusts, CNSD. The CNSD is a risk pooling scheme administered by NHS Resolution, formerly known as the NHS Litigation Authority, which handles clinical negligence claims against member NHS bodies in England. NHS trusts in England pay an annual premium to the scheme, which then covers the costs of any claims made against them. In essence, the CNSD has replaced the old Crown indemnity arrangement for NHS trusts in England. It serves a similar purpose, but operates as a separate scheme managed by NHS Resolution. For general practitioners, a similar scheme called the Clinical Negligence Scheme for General Practice, CNSGP, was introduced in April 2019. This scheme provides indemnity coverage for NHS activities carried out by general practice staff. These schemes are likely what your medical insurers are referring to when they mention that your annual fee is reduced due to their existence. Aims and objectives. The Clinical Negligence Scheme for Trusts, CNSD, is a risk pooling scheme operated by NHS Resolution, formerly the NHS Litigation Authority, in England. Its primary aims and objectives are to provide indemnity coverage for NHS trusts against clinical negligence claims, to manage and settle claims efficiently and fairly, to reduce the incidence of clinical negligence by promoting good risk management practices and sharing lessons learned from claims, to ensure that the NHS has sufficient financial resources to meet the costs of clinical negligence claims.
Cost. In conservative terms, the cost of harm for England alone is around £10 billion in real value claims per year. Costs have been massaged down by discounting to £6,278 million. The piggy bank. Figures like the £10 billion also do not give a full scale of the issue. It is important to understand what money goes into provision. NHS Resolution states. The year-end provision has also changed compared to last year. As of the 31st of March, 2023 provision was £69,614 million, compared to £128,550 million in 2021-22. Again, the changes in HMT discount rates are the primary factor in this decrease. Without the changes in discount rates, the provision would have been £144,218 million. NHS Resolution states. A provision is a liability of uncertain timing or amount. The provision in the NHS Resolution accounts is for claims arising from incidents up to and including the balance sheet date, the 31st of March 2023. This includes claims that we have already received, and those that we expect to receive in the future because of the length of time it can take for a claim to come forward after an incident. What does that mean? Breaking it down into the simplest terms, it's like this. Imagine that the NHS has a big piggy bank called a provision. This piggy bank is used to pay for mistakes that doctors or nurses might make while treating patients. These mistakes are called clinical negligence. Sometimes, when a mistake happens, the patient or their family might ask the NHS to pay them money because of the mistake. This is called a claim. The NHS puts money into the piggy bank to make sure they have enough to pay for all the claims, even the ones that might happen in the future. This is important because sometimes people don't make a claim right away, and it can take a long time before they ask for money. The amount of money in the piggy bank is called the provision. It's the total amount of money the NHS thinks they'll need to pay for all the claims, including the ones they know about now and the ones that might happen in the future. To figure out how much money to put in the piggy bank, the NHS uses a special calculation that takes into account the value of money over time. This is called discounting. So, in simple terms, the provision is like a savings account that the NHS uses to make sure they have enough money to pay for any mistakes that might happen, even if the claim comes in many years later.
Unpacking the discount. Observe that the 2022-23 provision was cut to £69,614 million, compared to £128,550 million in 2021-22, that is, a 46% cut. For the previous financial year there was a 51% increase in the provision from £85.2 billion to £128.6 billion. These fluctuations are almost entirely due to His Majesty's Treasury, HMT, discount rates. But what is this discount? From the perspective of the average person, the discount rate is essentially a tool that the government, through His Majesty's Treasury, HMT, can use to adjust the amount of money that the NHS needs to set aside to cover the costs of clinical negligence claims. When HMT sets a higher discount rate, it effectively reduces the amount of money that the NHS needs to pay out in the future for these claims. In other words, the government is saying that, due to various economic and financial factors, the NHS can afford to pay less for these claims over time. By adjusting the discount rate, the government can effectively control how much the NHS needs to pay out for clinical negligence claims over time, based on its assessment of various fiscal, economic, and political factors. The decision-making process behind setting the discount rate is often not transparent to the general public, typically carried out at the highest levels of government, particularly within His Majesty's Treasury, HMT. It is unlikely that the facts and figures that lead to increasing the discount are ever to be seen by the general public, as that's a matter at the highest level of HMT. There are a few reasons for this lack of transparency. 1. Technical complexity. 2. Political sensitivity. 3. Commercial confidentiality. 4. Public trust.
Key takeaways. The Clinical Negligence Scheme for Trusts, CNST, is a risk pooling scheme in England that provides indemnity coverage for NHS trusts against clinical negligence claims. Scotland, Wales, and Northern Ireland have similar but separate schemes. The costs of clinical negligence claims have risen significantly over the years, with the total cost for the NHS in England reaching billions of pounds annually. These costs include settling claims, legal fees, and operating expenses. NHS Resolution, which manages the CNST, reports a provision for claims each year. The provision represents the estimated future costs of all known claims and those expected to arise in the future, discounted to their present value. The discount rate, set by His Majesty's Treasury, HMT, reflects the expected rate of return on investment over time. Changes in the discount rate can significantly impact the total cost of clinical negligence claims. A higher discount rate reduces the present value of future claims, while a lower discount rate increases it. The decision to change the discount rate is made by the government, taking into account various factors such as economic conditions, investment returns, and public finances. However, the decision-making process is often not transparent to the general public. 7. While adjusting the discount rate gives the government control over NHS finances, it also affects the compensation received by patients harmed by clinical negligence. Balancing these considerations is a challenge for policymakers. 8. In 2022-23, a change in the discount rate led to a significant reduction in the provision for clinical negligence claims compared to the previous year, highlighting the impact of such changes on NHS finances.